Hi guys, I'm so excited. Today we have Nour on. She's a third-year medical student, a future gynecologist, and she loves women's health and is here to share all things women's health.
Thank you guys for having me. I'm so excited.
Thank you for coming,
Thank you so
Nour.
much for coming.
Thank you guys.
Okay, so I did a poll on Instagram and we got so many questions about why women are so exhausted or you feel so tired, you can't make it through the day, but your labs come back normal. So like,
There's so much I can say about this, but you know, a lot of patients when they do come in, they report like irregular menses. They say my period's not regular and I don't know why. I don't know what's happening.
Yeah.
We do the labs and everything comes back normal. And then we have a deeper talk with them. And then we're like, how's your lifestyle? Like, what do you do for work? How do you balance stuff? And a lot of the common denominator between these women is that they have really high anxiety levels. They are usually high achieving women and they have really rigorous careers, or even if they don't, just rigorous lifestyles. And their coping mechanisms just are not as great as they should be. So they end up having so much anxiety and so much cortisol. And so their period becomes irregular and they don't know why. And everything is normal. The labs are normal. But once you talk to them about like lifestyle modifications and how to deal with their anxiety better, maybe even go on anxiety medication, their period starts becoming more regular just because their anxiety is more controlled.
Wow.
And I think that's really not talked about enough.
Yeah.
Because a lot of people think, okay, like when this person, oh, they have a great life, they have like 4 kids, everything's great. But I feel like with more success in life, I feel like a lot of anxiety comes with it. You
managing everything.
More money, more problems.
More money, more problems, for real. It's so serious.
Yeah.
But I feel like even like in my own personal experience, like going through med school, it has been really anxiety inducing. And I've even noticed like I'm not sleeping as well. I'm like struggling with my period sometimes even. And I don't know why. And then when I sit with myself, I'm like, no, like you had like 5 exams this month and you had so many assignments. Of course you're stressed. And then you're married or you have kids or whatever, that even adds more. And that's just what I think is going on.
Yeah.
What tips would you give somebody? Like say somebody comes in and then you find out they have a high stress job and all, what tips do you give them to try and like kind of mellow it out?
So I think that everyone has a different approach because some people can accommodate certain, like we can remove some stressors for some people's life and then from other people we can't. For an example, a lot of women are stressed about kids or they are postpartum or they don't know how to deal with it. You can't just say, run away from your kids, you know, just don't spend time with your kids. So you try to modify their life. You try to tell them maybe take an hour for yourself of the day. Try to make a to-do list if you're overwhelmed. It's really small modifications to your life, but they really are going to be tailored towards every person differently. And when some people have tried all of this and they still have anxiety, we do recommend like anti-anxiolytics. And then that usually helps them to calm down, you know, benzos. Who doesn't love benzos?
So I've noticed like Prozac has been like a big thing on reality TV shows.
Yes.
They've been talking
I
about
feel like that was so old school.
I thought so too, but
Prozac.
now like so many people are on Prozac and they're like happy.
It's it's an antidepressant and it does make a difference. But Prozac, you know what? Prozac was prescribed a lot when I was in psych, when I was doing my psych rotations. It is great.
Okay.
If you do struggle with depression or you even are just not where you want to be mentally, Prozac is a really good alternative. But I'm not someone who loves to push medications first. I love to try doing anything about your lifestyle that can change. Because I think you can be on meds forever, but nothing internally is going to change until you make changes for yourself. And you have to be your biggest advocate. Because no one's going to do it for you. 100%. You have to do the work yourself.
And then when you brought up cortisol, how do you know you have high cortisol when all your labs do come back normal? Like, how do you know?
So cortisol is really high in the morning and we don't test cortisol in the morning. We'll have people come in around sometime in the afternoon because it spikes in the morning again. So we wait for it to level out and then we do it on lab work and it will come up. If it doesn't come up on your lab work, then you maybe don't have high cortisol. Maybe you just have high anxiety. because they're not the same thing.
Yeah, I'm kind of confused. Like,
I
what is
know.
cortisol? 'Cause
Yeah.
it's like such a
It's
trigger
your-
word right
yeah,
now.
I
it
feel like
is.
everything is like
yeah.
I told her I like spiraled down this rabbit
is
hole on
bad.
Instagram. Yeah, because I was, like your phone listens to you. So I obviously was talking about cortisol. And then I went down this rabbit hole of cortisol and I was like calling Rochelle, like, I definitely have high cortisol. Like I have my period every 2 weeks. Like I'm losing my mind. I'm like, I don't know what's happening.
No.
And she's like, Nicole, and then I just feel like it's a trigger word that everyone's using. So like, don't you feel like that everyone kind of
think
says that right now?
Everyone does say, "Oh, I have high cortisol."
Yeah.
having high stress and high cortisol are
It's
really
different.
different.
Okay.
Yes,
Okay.
high cortisol can happen from so many different reasons, but the biggest one is high stress.
Okay.
So if you're someone who is in high stress 24/7, I'm talking everything around you. Everything around you gets you really stressed out. Your cortisol will most likely reflect that. But if you're someone who goes through episodes of stress, maybe your cortisol is not going to reflect that just because you're not in that constant fight or flight mode. Do you know what I mean?
Yeah, I see what you're saying.
But stress and cortisol needs to be addressed differently because having high cortisol could be an immune issue. It could be a hormone issue. It doesn't necessarily come from stress. Obviously, that's the stress hormone, we love to call it. But high stress does not mean high cortisol. High cortisol, that will show on your face. It will show on your body. If you have high cortisol, you'll gain weight. Your face will turn a little more round than what it usually is.
Is it like down here?
It's like around here.
Yeah.
They call it like moon faces.
Yes.
So your face will
yes.
become more round if you have high
Yes.
cortisol.
Does she look like she has it?
No, she's snatched. Are you kidding me?
I told you.
Look at her
Thank
cheekbones.
you. No, thank you. But now I know what you're talking about because I
Yes.
have seen this and I've seen people's go away. Do you, and to pinpoint on the high cortisol, do you think taking GLP, if someone had high cortisol, helps with the moon face and like
Yes.
inflammation and all
Yes,
that?
absolutely.
Okay.
I love GLP.
Okay.
It is my favorite drug right now.
Okay.
It has shown to have so many more benefits than it does have risks. And at the same time, when you have high cortisol, again, the weight gain, your cholesterol increases, your face is more round, you gain some weight. Like everything is just not great when your cortisol is high. So taking something like Ozempic or Mounjaro or whatever, that will increase your cholesterol, that will increase your weight, it will increase your energy levels. Everything that you feel when your cortisol is high or when you're gaining weight, whatever it may be, Ozempic is the cure, and it's my favorite drug.
Oh, wow. So what's the difference between all the different brands like Trizipatide?
So
Ozempic?
yeah, I hate how I pronounce it, but like trizipatide or trizipapeptide. That one is more commonly known as Mounjaro, and that one is mainly targeted for weight loss. Versus GLP-1 semaglutide, Ozempic or Wegovy, they are more they're more for diabetes. They act on glycolysis, which is how your body breaks down sugar, and they just expedite that. You know what I mean? And with Ozempic, it helps a lot with people who have insulin resistance and all that stuff. The best thing I could say is if you are diabetic or you think you're pre-diabetic or your numbers are just not where you want them to be, Ozempic is the move. Like semaglutide, GLP-1 is the move.
Okay.
Versus if your only issue is weight loss, then Mounjaro would be the best thing that you can go on because it attacks more the fat cells and you just lose more weight with less side effects. And I love that about Mounjaro.
Oh, cool.
Yeah, it's good.
Yeah.
Big fan.
Okay. And then what about how do you say it?
PCOS. Okay.
PCOS. Because, and this is what I've heard too, to piggyback on GLPs. We have a friend that, my sister, she thinks that she's been diagnosed with PCOS. She's not on a GLP. I've been telling her to get on a GLP because they say she has it. And my sister is this big, like she's so tiny. And this is she's not even heavy, but it's like the heaviest she's been as she is right now. And she can't lose weight and she's doing everything. And I told her, it's like, if it's PCOS, if I'm not mistaken, like you hold on to fat more.
You do.
So I told her, I think that's why, because she's like eating good, working out, like it has nothing to do with that. And I told her to get on GLP because of that. And then we have another friend that got on a GLP because she has PCOS to get fertility.
Yes.
Yeah.
To have a baby.
She
Have a
asked,
baby,
she wanted to know what your thoughts were on
Okay.
treating PCOS with GLP-1.
Okay. So before we look at treatment, let's talk about PCOS.
Oh yeah,
and like
because
what
I don't know anything
happens
about
with
it.
it. Yeah.
Okay.
So to be diagnosed with PCOS, you have to have 2 out of these 3 criteria. And basically the first one is irregular periods, which is really common. Irregular periods, they're coming at random times. They're not coming at all. They're spaced out further apart, not closer apart. So it's more like for like the more
bigger
you're
gaps.
going without it. Yes. So that's the first criteria. The second one is basically the symptoms of it. So a lot of acne at an age where you're not a teenager anymore, or hairs growing at places where they shouldn't for a girl, like around your chin area, maybe your beard area. That's like a second criteria. The third criteria is when we do an ultrasound, we can see cysts on your ovaries. And that's why it's called polycystic ovarian syndrome, PCOS. So you need to have 2 out of 3 of these criteria to be diagnosed with PCOS. You don't have to just have the cysts. You just need to have, whether it's the irregular periods, the symptoms of like the acne and the high cortisol and all that stuff, or again, the, what's it called? The cysts on your ovaries.
Yes.
Once you're diagnosed with PCOS, the first thing that a doctor will do is they'll prescribe you oral contraceptive pills. So they're just trying to do birth control.
Okay.
To regulate your period, to make sure that it comes every 30 days and make sure you're having a normal cycle.
Okay.
And then after they do this, they try to treat the associated symptoms, which is the hair growth, the acne. Like imagine being 35 with like full on acne. Like it's not fun.
Yeah.
You know what I mean?
Yeah.
So then they treat that. And then if you're dealing with obesity with it, that's when the GLP-1 comes in.
Yeah.
Because when you have PCOS, the reason why you have it, your hormones are unstable. So your, what's it called? Your testosterone is high, your androgens are high, and it's mainly from insulin resistance. So you have insulin resistance, you have high test. As a woman, that's never fun to experience.
Yeah.
So going on something like GLP-1 just takes away a lot of the associated symptoms. So the obesity, they also have something called truncal obesity. So they hold the weight around the stomach area.
Yeah.
Again, not fun for a girl.
Yeah.
So everything that they do, it's not curable. So they try to just treat the symptoms. So going on GLP-1, if you're obese, it's great. If you're not obese and you're not necessarily dealing with the other symptoms with the acne and the hair growth and like areas you don't want it to be, then being on birth control is enough for sure.
Oh.
Yeah.
What if you're trying to get pregnant?
Birth control would be the best thing. I know it sounds counterintuitive,
Yeah,
but
that's weird.
it's so weird. But
Yeah.
the reason why PCOS causes infertility is because your cycle is so irregular. You don't know when you're ovulating. You might think, okay, it's been 11 to 15 days from my period. This is my ovulation period.
Yeah.
But if your regular cycle is like 50 days or 60 days, then you don't know when you're ovulating, and therefore you're just a little lost on how you're getting pregnant, and it just doesn't work. And also the cysts on your ovaries really inhibit that. But going on the birth control for 6 months to 8 months just to regulate your period, and also the birth control will have hormones to decrease cysts. Like the cysts will go away.
Oh, it feeds it kind of, so it just like withers away.
Exactly.
Okay.
So you have to go on birth control first for about 6 to 8 months is usually recommended. Once you feel like your period is more regular and your hormones are more controlled, your fertility goes higher. And then people tend to see success for, what's the word? They're more successful to get pregnant.
Yeah.
Okay.
They're just
fertile,
a little more
fertile.
They're more fertile.
Oh, okay.
Exactly. So that's
Okay.
it. Yeah.
That's very interesting.
Yeah.
Birth control. I know. It's like
I know.
how to have kids
Yeah.
on birth
well,
control.
haven't you been
Yeah.
hearing too the Ozempic babies? Have you
Yeah,
been hearing
I
that's how like
have.
all these people have been getting pregnant when they're on Ozempic.
Oh, like
Because-
they're more,
Yeah, like they're
We're
more
getting
fertile. That's what
pregnant
they're
more,
calling
yeah.
Ozempic. Yeah,
Oh, I
they're
didn't- so
calling,
funny.
Yeah,
I was like,
yeah.
what's an Ozempic baby?
Yeah, Ozempic baby. So like that's what I'm saying. Like they're taking the GLP, but then they get pregnant on the GLP, and they're calling them Ozempic babies because it's making them more fertile.
Yeah.
Because because their hormones are more.
It's the obesity thing that even if you're a healthy person and you don't have PCOS, when you're obese, it is harder to get pregnant. And
In general?
Like
Okay.
it's just harder.
Okay.
It's not because of positioning. It's not because of anything like that. It's
Yeah.
just your body's not really receptive, and there's no other really a better way to describe it. Then your body's just not as receptive.
It's kind of shut down.
Kind
shut
of,
off.
yeah. And again, your body's more focused on like your cholesterol, and your body kind of acts in a way where it fights all these things naturally. So your body's constantly fighting with obesity. That's how I think about it. Like
it's like a battle constantly.
It really is.
Yeah.
So just when you're bigger, it's harder to get pregnant. And Ozempic has helped with that, but it's not Ozempic itself that's making you more fertile. It's just the fact that you're less obese.
Yeah.
Okay.
I know, isn't that crazy?
Yeah.
I think that's amazing though.
Yeah.
Because that has helped a lot of people.
Yeah.
It's helped so much, even with lifestyle.
Yes.
Like, I'm sorry, being skinny is a dream. Are you
Exactly.
kidding me? Just
Exactly.
fitting in your clothes.
Exactly.
Just feeling more comfortable in your own skin. And like, I know for me personally, when I was a little overweight, going to buy clothes was the worst day of my life.
I know.
Worst day of my life.
know.
I would
I
cry
know.
in the fitting rooms. I'm like, oh
know.
my God, this is horrible.
I know.
And now, like, with better lifestyle, or with, again, if someone's on Ozempic and they're losing the weight, their life is just gonna feel better.
Yes.
And it's
Yes.
you're gonna be lighter. You can be more athletic, more fit. If you have cholesterol, the numbers will go down. If you're diabetic, the numbers will go down.
Yeah.
If you have hypertension, the numbers will go down.
Yeah.
It's just, I love that drug.
Yeah.
Honestly.
I just feel like with anything that's good, there's always going to be bad.
Yes.
And then people go a little overboard or go too high dosage. And that's when people get sick and act stupid.
Yes.
But that's with anything.
That's with any drug.
Yeah, any drug.
If you open a pack of Advil and you just look at the little paper that's stuffed in it for the side effects, the paper's like this big.
Yeah.
And we're talking about Advil.
Yeah.
Something that you take like candy.
Yeah.
Like, oh, I have a headache, I'm just gonna take some Advil.
Yeah.
Or I have, I don't know, a little fever, I'm gonna take some Advil. So I feel like all kind of medications and all kind of drugs have side effects. Some worse than others. Some need to be administered more carefully. And also, like, don't take Ozempic if you don't need it.
Yeah.
And that's a big thing. Because, you know, girls struggle with body image all the time.
Yeah.
You might look at yourself and be like, oh my God, I'm so overweight. But then you're really not. Like, your BMI is normal. You look great. Everything about you looks great, and you're healthy. Your numbers are great.
Yeah.
So we also have to make sure, like, we don't cross that line of like, am I doing it for my health, or am I doing it solely for my body image, which is normal.
Yeah.
So I think with the correct labs and the correct doctor-guided prescription, if you take Ozempic, everything should be okay, honestly. Yeah.
Is there anything else you wanted to touch on about PCOS?
PCOS. I want to say that a lot of it goes undiagnosed sometimes, just because the symptoms are really soft in the beginning. Like acne, again, it's not something that maybe you'll pay too much attention to, but it actually affects 1 in 10 women. So it's important to always get checked up, always go to your OB-GYN. Ask if you're feeling like your period isn't going the right track, or you've been trying to get pregnant and it's just not working for you. Just go to your OB-GYN and ask them for a panel, and they'll help you diagnose it.
Oh, okay. So insurance changed. And so you used to get a PAP every year, and now they changed it. Is it like,
it's so
Every
ridiculous.
2 years now.
every 2 years?
I thought and then someone told me every
It was like
3.
4. Yeah, it
and
was
I said
something long.
that is insane. That's
a
not
little
how
too
it
far
is.
apart.
Yeah.
So what
Yeah.
are your thoughts on that? Do you think you, like last time I just
Is it
went
just
and
insurance,
I said
or-
I would pay out of pocket?
Yeah.
Like, do you recommend that, or do you think every other year's fine?
You know what? I would say every other year is fine if you took your HPV vaccine when you were younger.
Okay.
I don't know if I did. How do you know?
You can ask
You'd
medical
remember,
records.
probably.
No, because it's like a newer.
It's a newer thing.
It's a newer thing.
Yeah. Like, I know I took my HPVs
So my kids
when I was
did.
younger.
My kids
Yeah.
did. Like it's a newer thing. That's why I'm like, I don't even know if I took this.
It's kind of newer.
Yeah.
I want to say. I remember when I took it, like my mom was like, what is this? This is so new. And the doctor's like, yeah, this is a new vaccine.
Yeah.
And I'm pretty sure it's either 2 or 3 cycles that you have to go
It's
in and
two.
take it. Two. Yeah.
Yeah.
It was a long time ago.
Yeah.
But yeah, 2 times you come in like a few years apart,
Yeah,
and they give
yeah.
you the HPV vaccine. If you're already vaccinated, I think 2 years is more than enough. It does help prevent. You still might get it, obviously, if you're vaccinated, but it really does help prevent. And I know they're making it not mandatory, but extremely recommended. Like every time you go to a family doctor, they're going to be like, hey, have your son or daughter, because you can give it to your sons too.
Oh, you can?
Yeah. You give it to boys and girls. It's really...
I thought it was only girls.
No, it's both, because you can...
Do the boys get the vaccines too?
Yeah, because it's sexually transmitted.
See, I didn't know, because I have 2 girls, so I have girls, so I don't know.
If you have sons, they still take the HPV vaccine, because if HPV is a virus, it's called a human papilloma virus. Anyone can have it. So if you're older and you're having protected sex or unprotected sex, and one of you has HPV, then they can give it to the other. It's sexually transmitted. So it's just safer for both the girl and the guy to get vaccinated. So I want to say, if you're vaccinated, every 2 years is okay.
Okay.
If you're not vaccinated, every year is good, but also it's a really slow growing process.
Okay.
Honestly, like, you're not gonna develop cervical cancer overnight, especially if you're doing your screenings. Do you know what I mean?
Yeah.
I recommend every year, obviously. I recommend at every checkup. Like, I go to the doctor every 6 months, and I always ask her, like, can I get my pap? Can I get my pap?
What about labs? They never say
They never
labs.
want to do the labs.
I think
They
I got
never
Are you
labs.
serious?
Yes, I got labs because I asked for it, but I don't think I had gotten them in like 10 years or something.
Oh my God,
Yes.
10 years without labs?
Yeah.
That's crazy.
First of all, I hate
do we
getting my
need-
blood drawn.
Well, do we need to
I
like
hate
ask
going
Yeah.
how
Absolutely.
often?
Advocate for yourself.
Okay, so how often should we
I want
be
to say
getting
every
them?
6 months.
Oh my, what?
Really? I get my labs every 6 months.
Okay, and my and then
wow.
my client that's a doctor, he told me to be, if you want to be super accurate, it's every 3 months
Yes,
quarterly.
but that's too
I know that's
much.
ridiculous, and I
Yeah.
can't. No one can do that. I didn't want to do it twice a year, but I didn't know that it was like that. And he said quarterly to see, like, I guess like your cycle and just I don't know.
It's like every 3 months is the recommended way. It's like,
Okay.
yes, but I think that's just too much.
I can't
personally.
even go twice a year.
So
I
who
know.
do you go to? Do you go to your primary care or your
I go to my
gynecologist?
primary care.
Okay.
But when I'm having a gyne issue, I'm going to my gynecologist.
Okay.
Okay.
Yeah. Like
Okay.
IUD insertion, gynecologist. But if I'm going to just get my blood work, I'm just going to go to my PCP.
Okay.
And then they'll just prescribe everything. But I'm honestly super on top of it. Like, I go every 6 months and I'm like, hey, I want a lipid panel. I want my blood sugar. I want a CBC. I want everything. And that's what even my husband now, he always laughs. He's like, do I have to do this? I'm like, yes.
Oh.
This is your health. You need to go.
Yeah.
And I think you just need to follow up and kind of really be your best advocate.
Yeah.
It is, I want to say, it's really hard for a doctor to follow up with every single patient and be like,
Yeah.
hey, where have you been? Like, it's been 6 months.
Yeah.
But I just feel like if you go and you ask, you will receive.
Okay.
Ask and you shall receive.
Okay.
Yeah.
Love that.
I
And
know.
always advocate for yourself. If you feel like a doctor's not listening enough, yell. Like, be like, hey,
Okay.
I feel different about my body. I feel like something's not right.
Yeah.
Please do further workups.
Yeah.
Please do further testing. Because you
Yeah.
know your body best.
Yeah.
He's not with you, or he or she, the doctor, they're not with you
Yeah.
every second of every day.
Yeah.
So you know yourself the best. You know your body the best. And you have to listen to your body.
Okay.
You really do.
Okay. I didn't even know this was a thing, but we got this question.
Mm-hmm.
Why does your body store fat differently after age 35? Is that a thing?
Yeah.
Because I'm like, oh, I'm storing fat differently now? Great.
Your metabolism changes with age.
Okay.
And that's just a normal process of aging. So when you're younger, when you're like a teenager, like, I'm sure with your kids, they eat probably double the quantities that you eat, but nothing's being stored.
Yeah.
They just, they burn,
burn
it
it.
so
Yeah.
fast. And it's just, your metabolism is just on crack when you're a teenager. Everything's quicker, everything's faster. And as you age slowly, everything changes. So for an example, a lot of women are obsessed with their collagen, but collagen stops being produced at 25. So starting 25 years old, your collagen kind of flatlines. And you're just
25?
25.
I know,
I
That's
thought
so
it was
young.
older than that.
No, it's
Jesus.
literally 25.
I had no idea. 25
It's so
is young.
Yes. And that's when I'm like, I always tell my husband, like, I should get Botox. I'm 26. I have no more collagen. And then he's like, no, dude, like, you're young. But I was like, no, like, my body actually doesn't produce collagen the way it used to. It's
Yeah.
flatline.
Yeah.
So it's sad. Like, your body goes through changes, all types of changes, but collagen is a good example. And then your metabolism slows down about every 10 years. It'll take like a shift.
Yeah.
Okay.
So again, teenagers, they burn through it. 20s, still a really great time to like lose weight and get yourself to where you want to be.
Yeah.
In your 30s, it really slows down. Like
After you hit
just,
30, it's like
everything changes. My
Yeah.
knees hurt at 25.
Yeah.
I'm like, why do my knees hurt now?
your knees are.
My knees are always in so much pain, and I don't understand. I'm like, is this aging?
Yes.
Because I'm like, I used to like do everything, and now I'm like,
Yeah.
oh, Tony, hold on, like I need to stop right now.
Yeah.
Like my knees cannot do it anymore.
You're hilarious.
But yeah, everything changes with time. But I think there's a beauty in that. There's a beauty in slowing down.
Yeah.
Because you can't do the same things you did as a teenager. So when you start, when your body slows down, like slow down with it. There's something really therapeutic about it, honestly. Just taking life easy.
I love that too. I know.
It's good vibes.
Yeah, it is.
I had a question about like, what did you recommend? Oh, do you want to go?
Oh no. So okay. So do you do anything? Because you do with PCOS and stuff like that. Are you with birthing, or do you do anything like with that?
So I did a few shifts on labor and delivery in my rotation, and that was my favorite part. That was really my favorite part. I love labor and delivery. I think the first time I ever saw a woman give birth, I cried. Like I was crying with her. I'm like, oh my God, this is so beautiful.
Yeah.
I love labor and delivery. I think it's so natural and so beautiful.
Yeah.
And I like, moms are super women.
Yeah.
They're not real.
Yeah.
Yeah.
You push the whole ass baby out of
Yeah.
you. That is crazy.
Yeah.
Yeah.
Do you think it's true? Because I've always heard this. It takes 5 years for all of your organs and everything to go back to get back together in a sense of how we were. Everything never goes back perfectly, but like I heard it 5 full years after you give birth to a baby.
Yes.
Your organs and everything.
Yes. You know what?
it's
If you had
wild.
a C-section.
I had a C-section.
Yeah. If you had a C-section, C-sections are more harsher on the body.
Yeah.
Just because you have to
take
cut
out the
in,
organs.
Yeah. You have to cut through 7 layers of your skin.
7?
7
Oh, wow.
layers. You do skin, fat, fascia, and then you go into the abdominal muscles, and then you go into the uterus, and it's just a lot. Like
Yeah.
you're really cutting, and that causes trauma to your skin.
Yeah.
Like any cut in your skin, like when you get a paper cut,
Yeah.
aren't you like, ow, like that
Yes,
stings.
yes.
Dude, imagine someone cutting through 7 layers of your skin.
I know.
Dear.
It's really traumatic, and
horrible.
it's kind of like, oh, she gave birth. Like, no, she just went through really
Surgery.
deep surgery. Like
Yeah.
it's not easy.
Yeah.
But when you have a C-section, the doctors do recommend that you continue having C-sections
Yeah.
because of the trauma that went through your body. And
Yeah.
sometimes if you push,
The VBAC.
like let's say 2 years after you had a C-section, you
can
could
tear.
rupture your
Yes.
uterus.
I know. I don't understand why girls
crazy.
try to do it. I had one emergency C-section, and I'm always like, yeah, like I'm doing it again.
Yeah.
But I don't understand why girls try to do that. I'm always like, girl, it's not worth it. And everything down there is great. Why would you want to ruin
Yes.
it? Like, why are you trying
Yes.
to?
It bounces back.
I tell
It
girls
really
this
does.
all the time. I'm like, why would you touch that?
Yeah.
But I have heard that, and it can rupture inner lining of like your muscle walls. And
It can cause really bad
I have heard
like
that.
complications.
Yeah.
And they tell you if you had a previous C-section, we're not going through vaginal.
Yeah.
Even if everything is normal,
Yeah.
it's just the risk is too high.
Yeah.
And again, if you're pushing and
There's no point.
No.
There's no
and
point.
honestly, naturally, you do give birth through your vagina. That's just the way it is. And as long as there's no complications, the baby isn't like placed incorrectly, because you know how they shift in your stomach?
Yeah.
Like, I don't know what your reason is for having a C-section,
Yeah.
but I'm sure whatever it was, it's probably because vaginal was just unsafe.
Yeah.
Am I wrong?
Yeah. I didn't even dilate to 2. I was like 3 days, and then they thought her heart rate was dropping.
Yeah.
So then it was.
Yeah.
Yeah.
It was critical.
Yeah.
It isn't, it's called an emergency C-section.
Yeah.
Like it is not really elective.
Yeah,
And a lot
no.
of countries in the world actually are pushing for vaginal, because now some women are like, I don't want to do it. I don't want to push. And they're like, I'm scared. And it's a very rational fear. You will
Yeah.
never experience more pain than like
Yeah.
a vaginal delivery.
Yeah.
Especially if you don't get an epidural. Like I see these women screaming. I'm like, I can't even, I don't hear people scream like that.
No.
Only in the labor and delivery. I'm like,
Yes.
oh my God.
I've heard it. It's fucking scary.
It's so scary. Sometimes like, is she dying?
Yes.
Really?
Yes.
I think they're dying sometimes.
I remember,
I'm like, are
Rochelle,
you
when
okay?
because I was in there for 3 days. I didn't dilate to 2. They did Pitocin, whatever, all the
Everything.
things, right?
Yeah.
And this other fear was another stylist in my salon years ago. She didn't get, so it was a very small hospital, and she didn't get the epidural. There's only one anesthesiologist on
Yeah.
call, and someone went into labor and delivery. So she had to get cut open with nothing.
Stop.
Because the other guy, the anesthesiologist, was with someone else. And he said, the husband said he could hear her screaming from outside the hospital.
No,
and
that's
so
crazy.
my fear was getting it too late or too early. Then I've heard this is you get it too early. Then when you're going to do it, all of it's backed off and it's like, go, sorry, you're screwed. So I was so scared. And I heard a woman, I kept saying, did she get her epidural? And the lady's like, I don't know. And I'm like, did that? Because I sounded like someone was murdering them.
Yes, it's really the loudest screams you'll ever hear.
Yeah.
Honestly.
Yeah, it's the most painful.
It is. So the fear is rational.
Yeah.
You're still pushing an entire human being through your organs, through your pelvic bones, like through everything. And you're dilating. Like dilating alone is so painful.
Yeah.
Like everything about it is really so painful.
Yeah.
But the pain of doing a C-section, in my opinion, is worse.
Yeah.
Worse in recovery, worse in your stomach, worse in so many different ways.
Yeah.
And just again, the risk of having future babies. You don't know when your first or your last baby is going to be. So you're just like, okay, is this my first pregnancy? All right, if I have a second pregnancy, like what am I going to do? And so I think if you have the chance to do it vaginally, just go ahead and do it. Get your epidural. You don't need to endure the pain, but get your epidural and just do it vaginally. Other than that, a C-section is just for emergencies and they're unfortunate, but I'm glad that it is an option.
Yeah.
You know?
100%.
Yeah.
100%.
So yeah, there's risks.
Yeah.
I love labor and delivery.
Oh,
it's so good.
It's so cute.
Okay, if you could give every woman one healthy habit to start tomorrow, what would it be?
Ooh, okay.
That's a good
Depends on your
question.
age. I'm going to go with age.
Okay.
If you are a teenager, get your HPV vaccination and always use protection.
Okay.
Always use protection, even if you're on birth control.
Okay.
Just use protection, use condoms, just to prevent STIs and all that good stuff.
Okay.
If you are a woman in your 20s and you're trying to get pregnant, I would say make your lifestyle start to look as similar as it's gonna be when you're pregnant. So start cutting off alcohol. Start cutting off the things that you will cut off when you're pregnant. Because we cut off these things to protect the baby. So you might as well protect yourself.
Yeah.
You know, just don't eat sushi
Processed
that's too
foods.
high in mercury. Don't eat cured meats. It's already not healthy.
Yeah.
You're just stopping it because you're developing a baby and you want to make sure that baby like develops as strongly as possible. So you stop that for yourself. If you are in your 30s to 40s, I would say always get your mammograms.
Okay.
Do your at-home breast tests. They go undiagnosed a lot. So if you're in your 30s and 40s, just go ahead and do your at-home breast tests. If you are above 40 and you're almost entering menopause, I would say start taking your vitamin D because your bones are about to go really brittle.
Okay.
So start taking your vitamin Ds.
Okay.
I know a lot of women develop osteoporosis.
Okay, is that the bone density loss?
Yeah, it is the bone density loss. So just take as much
vitamin D?
Vitamin D.
I'm always low on vitamin D because I think I'm indoors so much. And have you seen the red light therapy?
Yes, I have.
I have it at home. Does that help with vitamin D? Because I'm not in the
I'm
sun.
not sure. I'm honestly not sure.
Okay.
I want to say I don't think so.
Okay.
But I'm not sure. Like, don't take my word for it.
But just take a supplement for vitamin D?
Yeah. Take like a 50,000 milligram supplement.
Okay.
That one's great.
A day?
If they have daily, or you could do an injection. But
of vitamin D?
I think it's a week. I think the 50,000 is per week. Yeah. And then the injection is also once a week. I love a good injection just because your skin just absorbs it so much better.
Yeah.
Like your blood vessels absorb it so much better versus like
a pill.
It goes through something called like first pass, which basically a lot of your pill gets kind of
thrown
in
away.
your poop
Yeah.
and not really absorbed in your body. So you might as well just do injections. I think injections are the best way. And a lot of people are deficient in vitamin D.
Yeah.
More than you think. Most women are already deficient in vitamin D.
I was very low. I was getting really tired all the time from vitamin D. This sounds stupid. Does B12 injections have vitamin D in it?
No, they don't. But B12 is a great like supplement to be on.
Okay.
It promotes like energy levels and all that good stuff.
Yeah.
Okay.
But they're different.
Okay.
They're different.
Okay.
Yeah.
I didn't know there was a vitamin D injection.
Yeah, there is.
Is there a peptide for vitamin D?
What's a peptide? What do you mean by
Peptide,
Like
like-
an enzyme?
Yeah, or like or any of the peptides.
I don't think
like
so.
no, like the glow stack. That's why I'm asking that. Like,
I don't know what that is,
oh,
honestly.
you don't? Okay, this is all the peptide stuff.
I'm a very like textbook person, like pill or injection. I'm not sure
okay.
about everything else.
Okay.
I always prefer an injection because of the way your body,
body
absorbs
consumes it.
Yeah.
Yeah.
Your body takes it all, basically.
Okay.
Versus when you eat something, a lot of it gets tossed away.
Yeah, that makes sense.
Yeah.
Yeah, that makes sense. How soon and how much longer do you have to do like, do you have one more full year? Like, how soon can you be a doctor? Like,
one more year.
One more year?
One more year.
exciting.
Yeah, I'm
Wow.
so excited. It's been a really long journey.
Wow.
It's been a little too long, in my opinion.
Yeah.
I have spent my early 20s and my mid 20s doing med school and pre-med and all that stuff. And
Yeah.
it's a long journey, but I
Yeah.
recommend it if you love it.
Yeah.
If you love the journey.
Well, I can
do
tell
it.
you're very passionate about
Yeah.
it.
I love women's health.
Yeah.
I've kind of always known that I wanted to do women's health. Initially, I wanted to do derm just because everyone told me, you look like a derm. You look like you'd be like,
Really?
I got that so
How funny.
much.
Yeah.
It was
You look like a derm.
Even in my rotations, like a lot of my doctors are like, so do you want to do derm? I'm like, no, I want to do OB-GYN.
Yeah.
And they're like, really? I'm like, yes, it's
Yeah.
so good.
Yeah.
I don't know. I just think it's a really great thing to be. And like when you're going to OB-GYN, like, do you want it to be a girl or a guy?
A girl.
Thank you.
Yeah.
Always.
I only see girls.
It's funny, and I purposely request them, and then same thing. Or if it's like if it's the guy, and then the physician assistant or whatever,
The PA.
yeah, the PA
Yeah.
is a girl. I always go. I'll see the girl the whole
Yeah.
time, and like if the guy delivered, that's not a big deal.
Yeah,
but like
I agree.
I just wanted to see her the whole
Yeah.
time.
I when I go to an OB-GYN, like I want it to be a woman.
Yeah.
And I feel like she'll understand me better.
Yes.
Because she has
We have the same
probably
problems.
experienced it. You know what I mean?
Yes.
As much as male doctors are great at their job, and I know they do their best, you just don't get it.
Yeah.
Like,
Yeah.
You didn't get
don't.
period cramps.
No.
You didn't
Yeah.
push a baby out of you.
Yeah.
You're not thinking that your IUD is uncomfortable. You know what
Yeah.
I mean? Like I feel
Yeah.
like only girls go through that. And like
Yes.
for someone to treat you really well, they have to kind of
Understand your
resonate with
body.
what you're going
Yeah.
through.
Yeah.
That's just my
So
opinion.
one more year, and then
Yes.
then you can pick saying I want to be an OB.
Yes. Oh. One more year and then I'll apply to Match.
What's
And
Match?
Matching is like a program that basically every US doctor has to go through. They apply on an application called ERAS, ERAS, and you pick all the places that you want to match into, like all the hospitals you want to work at with a specialty that you're interested in. And then it's almost like a reveal because I think, Match is next week. Match 2027 is next week. Everyone like gets a reveal of, hey, you matched there. It's not like I'm applying to a job application, get an interview. Like, yes, you still get an interview, but you don't know whether you got the job or not unless it's match week, which is in 2 weeks.
So that's
from
your
now.
match week.
No, I'm not
okay.
matching yet. I'm
Okay.
doing next year's match.
Okay.
Yeah, because I'm still in my third year.
It's only on the fourth year. Only at the
Yeah,
fourth
fourth
year.
year you start applying, and then by the end of fourth year you'll get a response that you've matched to a certain program, which is great.
Do you know where you are wanting to match with?
I have no idea. I'm not even gonna lie. I just know I want to be placed in California.
Yeah.
Matches all over the United States, and you never know what you're
So
gonna
you
get.
might match, and you might have to move somewhere. You and your husband.
Yes.
Oh
it's
my
a big fear that we
God.
have because
Is he gonna move with you, or are you guys gonna do the
he's
long
coming
distance?
with
Okay.
me.
Okay.
I'm dragging him everywhere.
Yeah. Yeah.
No, I think
good.
we did long distance when I was in Grenada for school, and that was awful. I'm
Yeah.
never doing
Yeah.
that ever again.
Yeah.
yeah,
Yeah,
That
I would
was
never
not
do
it.
that either.
No.
Yeah, it's too hard.
That was not the vibes.
Yeah.
But you
Yeah.
gotta come back to OC to be our gynecologist.
Yes.
That's a dream. Are you
Well, I
kidding
think,
me?
and I'm like, I was telling her, I'm so happy that like you're young and you're like all
Yeah.
passionate about it because, again, it's all like this generation that they need to retire, and we need new people that have
Yes.
new visions, that have
Yes.
new on-sites, that have new.
to understand
A
the
fresh
issues right
lens.
now.
Yeah.
Absolutely.
Yeah.
Most of the doctors I work with are great doctors, but they're older.
Yes.
They're 50 plus and
Yeah.
they're in their own, like, they're great for the people that are at their age.
Yes.
But I feel like a lot of the patients that come in, they're in their early 20s, mid 20s, especially for OB-GYN, because that's when your body really changes.
Yeah.
Or you're getting pregnant for the first time or whatever. I think
Yeah.
having a younger
Yeah.
POV is
Yeah.
really going to be so different for so many different girls. Even for me, honestly.
Yeah.
I remember when I was young, like when I was 16, 17, that was not an appointment I looked forward to.
No,
I was dreading that appointment always, even until my age.
Still do. I still do.
I don't know why. We just dread it. It's,
yeah.
You know, it's a little personal.
Yeah, it's not fun.
Yeah.
Yeah.
It is personal.
Yeah.
It's very much like, open your legs.
Yeah.
You know, let me check on you.
Yeah.
But it's, again, you're getting really intimate with that doctor and you're like, okay, like I'm nervous. I'm already nervous. I'm not comfortable. And that's okay.
Yeah.
Like it's a normal feeling to have. But my goal in life is to just make every single patient super comfortable.
That's
like
so good.
we can talk.
Nice.
If I could put rosé out in the lobby, like I would. But I'm like, I don't know if that's
cute,
legal.
Yeah. You're so cute.
But I would love to make like a pink and white clinic.
That's
Like I just
so
want everyone to be
cute.
happy.
I know. That's
happy
so
vibes.
cute.
Yes.
Well, because that bedside manner, that means so much to me and I feel like anyone.
Yeah.
But like bedside manner with that kind of stuff, that's big.
Yeah.
Yeah.
That's big.
Yeah, it is. It can make
Yeah.
it can make or break an interaction.
100%.
You could meet a doctor that can make you hate your life just because of bad bedside manner, and vice versa. Like my current OB-GYN, I love her. She's fun. She's energetic. She's always listening. She's great, and it is the bedside manner. They're really. I aspire to be like her one day.
That's awesome.
Yeah, she's great.
That's awesome.
And what about probiotics? Like, do you think everyone should be on
Ooh.
probiotics? Or?
That's a great topic. You're talking like for yeast infections and stuff like that, right? Yes, absolutely be on your probiotics. Absolutely take them pill form. Natural foods like yogurt, you should eat more of. Yeast infections are really common, really common. And they also do go underdiagnosed because the symptoms for a yeast infection is just, you know, like a cottage cheese like discharge.
Yeah.
Or itchiness.
Yeah.
Those are the only symptoms for it.
Yeah.
And so some people might think, oh, like my discharge is a little off, but then it goes away by itself. So they never get it checked out. But then it'll reoccur. You know what I mean?
Yeah.
Yes, take your probiotics. Take a lot of probiotics.
Is there a brand that you like?
Honestly, I take the Lemmy Purr.
Oh, what's
By
that?
Kourtney
that's the one
Kardashian.
for
Really?
Let me purr. I heard that one is actually good.
It tastes
Hold
so
on,
good
is it
too.
the one that's supposed to be like
Is it like a
pineapple?
gummy?
Yes, it's
Yes,
pineapple
it's supposed to be
flavored.
pineapple. It's
Wait,
supposed-
is it a gummy or liquid?
Yeah, it's a gummy.
Oh.
Which I love a
Oh my
good
gosh,
gummy.
me and Nicole are on so many gummies.
We are.
I love a good gummy.
Are we gonna like add?
I
add
know.
gummies to
I
our-
know.
I take I take a lot of Lemmys.
Okay.
Do you
So
do
far-
above the recommended dosage?
No, I just
Okay.
take 2 a day, and that's the
Okay.
recommended
Okay.
dosage.
Okay.
I haven't personally had any sort of yeast infections or stuff in years, and I think it's because like proper care. Whenever I wear workout clothes or really tight clothes, like I try to take them off right away.
Yeah.
Just because that could promote
Yeah.
a yeast infection. Or after intercourse, make sure you wash up. A lot of people forget to do that, and it's
Yeah.
okay, but that can also cause a yeast infection. Taking antibiotics can cause a yeast infection.
Antibiotics?
my gosh,
Yes,
yes.
because you're killing all your bacteria. It's not selective. So your good
it kills
bacteria is also
everything.
gone. And then there's a pH imbalance, and there we go, a yeast infection.
Yeah.
So yeah, take your probiotics, eat a lot of yogurt like Greek yogurt, just plain Greek yogurt. And yeah, that helps a lot. Less sugar in your diet because yeast feeds on sugar.
Okay.
Stuff like that.
Okay.
Good to know.
Yeah.
I know.
What about you girlies?
What?
What about you girlies?
What
We should
about
play a
you?
game.
Okay. Yes.
Okay.
Game
We should
time.
play a game.
Okay.
Okay.
Let's
I
play a
love
game.
games.
I think we're gonna switch this around right now.
Oh, God. Okay.
Okay. So what has been like a really intense experience for you guys health-wise?
Intense experience. Well, I'm having hormonal acne and like my period every 2 weeks for a while. But then, and I'm not on any birth control or anything like that.
Yeah.
So, and I don't want to just go to the doctor and then say, put me on birth control. So I'm like, what's the point of doing that? So I'll try to do a lot of holistic things.
Yeah.
That's pretty much right. Like that's the
yeah.
only thing I can think of.
No,
that I'm, like,
actually,
having.
no. You have like the bad periods, the acne.
Yeah.
Yeah.
Severe. It takes over our
Severe.
whole life.
Yeah, I talk about it all the time. Yeah.
No, I mean, if you're feeling something's off, you should
Yeah.
absolutely go get that checked out.
Yeah. I just don't
Get
want
a-
them to just tell me, just to go back on birth control because I don't want to take birth control.
Yeah.
That's the problem.
And that's fair, actually, because birth control also has like its side effects.
Yeah.
You can gain some weight.
Yeah, like I don't want to be.
Swings.
Yeah, like I don't need
We're
that.
already moody. We don't need
that's
more.
what I'm saying. I don't want to take any more pills that I already have to.
I agree.
So that's mine.
Yeah, you know what? Go and ask for a hormonal panel.
I just did one.
Okay.
And they said everything was fine.
Everything was fine?
Yes.
I don't like that.
I know.
So, you know what we discussed about anxiety and managing our anxiety?
Yeah.
Maybe that's the issue.
That might
Honestly.
be. It might
Do
be.
you think you're anxious?
Yes.
Yeah. What's causing
I
you
am anxious.
some anxiety these days?
Oh, just everything. Life.
Raising
a family. Just like the what ifs, I guess.
Yes. Yeah. Well, you know what? I want to say that what you're going through is very normal, especially with kids. You told me you have like teenagers.
Yeah.
I can only imagine.
Yeah.
Managing teenagers.
Yeah.
That's tough.
Yeah, it's stressful.
Yeah, but take some time for yourself.
No, I do. I try.
Yeah.
And I like literally I'm so about self-care and like tomorrow I'm going to a Pilates class. I'm going to get a massage. I'm going to go to the sauna. So that's like my rot day, I guess. And like, you know what I mean? But I need to do like self-care stuff for sure.
Yeah. Maybe once your anxiety is more controlled, then those symptoms can go away by themselves.
That's true.
Yeah. That's what I've seen with a lot of women.
Yeah.
High achieving women. They're the most stressed out.
I know.
They really are.
I know. It sucks. Can't win them all, guys. We can't win them all.
No, man.
Yeah.
Yeah.
Yeah, that is hard. What about you?
Okay. TMI, sorry, Leo.
There's no such thing as TMI. It's tell me immediately. All right? It's tell me immediately.
Okay, I used to get like, I was like one of those people who like would get chronic yeast infections and it was so miserable. And then I would take like 1 million diflucan pills or whatever.
Yeah, fluconazole.
And, whatever. And it was
Is
like
it antibiotics?
It's an antifungal. So it's like for yeast.
Oh, okay.
But then once I started taking probiotics, it was like life changing.
Right.
But my gynecologist when I was younger, like never told me like
it's a new generation.
I know.
Okay.
This
That's
is an
what I'm
older
talking
generation
about.
thing
Yeah.
So it's
because
like-
it's more common for us to like we're more supplement based. Like we're like give me this, give me that.
Yeah.
Back
Yeah.
then the doctors were just like take the pill, it'll go away.
Yeah.
Yeah.
But it was like chronic. Like it was so bad.
Yeah,
It,
and
like,
it's very
ruined my
normal.
life.
Yeah.
It's so normal. Again, it's not discussed about enough, like how common a yeast infection is. I think every woman in her lifetime will probably get a yeast infection at least once.
Yeah.
But the probiotics do help. That's why I said, yes, take them. I know that I know they make a huge difference. It's all about the pH balance and it's all about the good bacteria. As long as your vagina has good bacteria, nothing's going to happen. Honestly.
Okay, so I stopped taking them for a while. I don't know why. And then I just started back up again and I've been getting like severe stomach pain. Like
probiotics?
I think that's what it is. And
Interesting.
and then I asked ChatGPT and it was like, because it like happens like if I take it at night, it happens like the next day and it's like so bad. Do you think I just need to change the brand?
Yeah, I was just going to say, because probiotics, they're not all made the same.
Yeah.
Some people put different kinds of blends in there.
Okay.
And your body might react differently to a blend. That's
Okay.
more of a GI problem, like gastrointestinal. But
And I feel like she's sensitive though with stuff.
yeah.
She's so sensitive with stuff.
skin.
Like I'll want her to try this protein bar and she's like, no, I'm not going to try that because
Yeah.
she's scared her stomach's
Yeah.
going to
Makes me
hurt.
nauseous.
I'm actually the same way.
Okay.
Really?
Oh my God. All my friends know this about me, TMI. But I rush to the bathroom at least 4 times a day.
Really?
No joke. It's like chronic. It's really bad.
God,
Fun
you poor
story.
thing.
Every time my husband and I go on a date night, you know, we eat whatever. I tend to eat and to need a bathroom immediately.
As soon as you're done eating?
As soon as I'm done eating,
Oh my
give me
God.
10 minutes and I need a bathroom.
Wow.
And I always tell myself like go before
Yeah.
we drive, before we do anything.
Yeah.
My husband was like, let's go drive down PCH, like scenic drive at sunset. I'm like, okay.
Yeah.
We're driving down and I start like sweating
Yeah.
and hyperventilating. And I'm like,
God.
you need to take me to like a gas station. I need a bathroom now. He's like,
Yeah.
right now? I'm like, now.
Yeah.
And then, so I start crying
Oh
because
my
I feel like
God,
I'm just
Nour.
gonna do it right
Yeah.
here, right now.
Yeah. Oh my
And so
God.
I start crying. He's like, are you really crying? I'm like, yes, take me to the
Yes.
bathroom.
Yes.
And I go to the bathroom and I run. You know that scene from White Chicks, like move, bitch. Like I have to go.
White chicks. Oh my God.
And that was literally me that
That
day.
is so
and he was
funny.
sitting in the car just laughing. He's like,
Oh, no.
there's no way. She just can't hold it in.
You're like,
And so my stomach
Why would
is
I
really
joke
sensitive.
about it?
Yes. So my stomach is so sensitive. Anytime I eat a full meal, I just have to run to the bathroom. So I know exactly what you mean about having a sensitive stomach.
Yeah.
Keep trying brands that work with you.
Okay.
And that work with what reacts well with you. Because
Okay.
everyone's different and nothing works for everyone.
Yeah.
Okay.
Every single person reacts very differently to
Yeah.
a certain medication or a certain drug or whatever it is. Yeah.
Okay.
So just tailor it to your needs.
Thank you, Nour.
Welcome. I got you.
I know. That is so funny.
But yeah, no, it's good vibes, guys.
Yeah.
What else? What's a TMI moment for you guys other than,
Oh
you
my
know,
God.
TMI about what?
Yeah.
let's say a boy situation.
Oh gosh, that's embarrassing. Or I don't know.
I don't know either. I don't think I have one. I don't even know. I can't think.
Yeah.
Wow, I have like 100 TMI moments that like ran through my
Okay,
mind
Oh
right
my
now.
God, let's
What's
hear
your
one of
TMI?
yours.
Yeah.
I'm like, wow,
Maybe it'll give me an
your
idea.
guys' lives are nice. They're calm. Mine is a little crazy.
Oh my God.
Oh my God. Another TMI moment. Let me think. My issues are always in the bathroom.
Is
I
it?
don't know why. Yeah,
That
it's a
is
really
so
bad
funny.
issue. One time, like I drank a little too much and then I was, feeling like I was gonna vomit.
Yeah.
And then I end up like basically having to like vomit and poop at the same time. So I'm like
Oh my
alternating on the
God.
bathroom. I'm like vomiting here, then pooping, and then vomiting and pooping. I'm like, oh my God, this is the nastiest thing
Oh
I've
my
ever done.
God. Where were you?
I was at my best friend's birthday.
Oh my God.
And it was really funny. I didn't even drink that much, honestly. It just, whatever I drank really upset my stomach.
And you were just
And
out
it
of
just
control.
had to go
Oh no.
Either way.
both ways. And
Both ways.
had to go
Oh my
both ways.
God.
And that was one of the moments that I was like, oh my God, is like, how am I ever going to come back from this? Like, this is so
That
embarrassing.
is so funny.
Oh no.
That is so
So
funny.
yeah, like I've had a few bathroom encounters, but that was one of them. And even, when Tony proposed to me, the day he proposed to me, I had a bathroom incident as well.
What
What?
happened?
He took me for brunch before it, but I went home, changed, used the bathroom, everything. On our way to him proposing, I don't know why. I don't know if I had a feeling. I don't think I had a feeling, but my stomach just acted up. On our way to our proposal, I have the same episode, like take me to a gas station.
Yeah.
I'm crying. I can't hold it
Yeah.
in. But I was wearing a really cute House of CB dress. And as I'm taking the dress off, I rip it.
Oh no.
Like I actually
Oh
rip it.
my
And I'm like,
God.
Your proposal dress?
my proposal dress.
Oh my God.
I had no idea I was getting proposed to, but I'm wearing a cute dress. It was our anniversary. He's like, yeah, like we're going out. I'm like, okay, like that's typical.
Yeah.
But then I ripped the dress in the bathroom. And I'm
my
like, oh my
God.
God. So I text him like, hey, I need your help. Like I ripped my dress. He runs to the bathroom. He's like, what do you mean you ripped your dress? I'm like, I ripped it. I need your help.
Yeah.
He does his magic. It looks decent.
Yeah.
We get back in the car and he looks irritated. Like he looks so sad that I ripped my dress. And I'm like, Tony, like it's fine. He's like, no, like I'm really upset you ripped your dress. And I'm like, what is going on with him? Like,
Yeah.
he's so sad over my dress. And it turns out because he was proposing, he
Yeah.
like wanted everything to be perfect. And again, my stomach lets me down again. But that's okay. It's just, yeah.
That is so
it was
funny.
Yeah.
Oh my gosh.
It was a funny story for sure.
Are you guys waiting to have kids since you are doing all
Ooh,
this?
Yeah.
Yeah.
So right now we are not gonna have kids anytime soon. Maybe 3, 4, 5, 6 years from now. Just because of school and getting our life together and also
Yeah.
like enjoying life together.
Yeah.
We're super
Totally.
young. Like I'm
Yeah.
26, he's 29. Like
Yeah.
having kids right now for us, like there's so much we want to experience
Yeah.
and so much we want to do,
Yeah.
and we're not ready. Like
Yeah.
I feel like a kid myself.
Yeah.
I'm like, I cannot take care of another human being.
Yeah.
I can't even take care of myself. You know, I need to control
Yes,
my
you
potty
can.
before I potty
Yes,
train
you
someone else.
can. Hold on, how old are you?
26.
See, I had 2 at 26, 24 and 26.
You're built different. Look
I
at
know.
you.
But I always tell people, I'm like, I would have had 2 kids right now. But it is, you're never going to be ready for it. You're never going to wake up one
Right?
day and be like, oh, I'm ready to freaking, raise a person.
See, I'm so scared of never having the feeling of like, I want to be a mom. That's
Really?
actually one of my biggest
fears?
fears. Yeah.
Really?
I one time even told Tony, like, am I ever gonna have the feeling? Because I feel like a lot of my friends are like getting
have
married,
that feeling.
starting to have kids, or wanting to have kids even. And I'm like, I think
it's for it's different for everyone though. Like you're literally in the middle of your career.
Yeah.
So like if you did that right now, you would put everything off track.
Yeah.
So I think maybe the feeling has to be with your brain, with the energy,
the circumstances,
with like the plan in your life. And again, we don't all plan our lives out.
Yeah.
Like if it happens, it happens.
Yeah.
But you know what I'm saying?
I know exactly.
You're
what
never
you're
gonna
saying.
wake up one day, even if every star was aligned and you had your, you were working and everything was perfect. You'd find another reason not to have a child.
Yeah.
You always can.
I know. I'm just scared. Like
I know.
And you know
what?
It's a fear in our generation.
I know. I've noticed
really
that.
is.
I know. I've noticed that my kids will even say like, I'm not gonna have kids. Both my girls, I'm not gonna have kids. And I'm like, why is all these kids say they don't want to have kids?
The world is scary right now.
It is scary.
I'm not even gonna lie.
It's scary.
Like, even I have a little sister, she's 17, and I'm so scared like for her all the time. I'm like, what is she experiencing? What is she seeing? And she's only my sister. Like, even like, I feel like if I have a kid, like, how is it going to be for them? Even with AI, I'm so scared of AI.
Yes.
AI scares me a little too much. I see some
too.
videos and I don't know that they're AI until I read the comments and they're like, oh, this is AI.
Yeah.
Like, I couldn't even
I
tell.
know.
Like, I couldn't
And
tell.
that's why it is sad because like I actually saw this post that millennials, because me and Rochelle are millennials, our generation is the best because we did not grow up with the internet. Like we're more creative, and but then we're still seeing the internet and AI and everything. Like we're full circle because we saw not having it, and then now we're having it.
Yeah,
it was this whole like post thing. I'll show you. It's kind of interesting.
No, you guys are lucky.
But because we've been through, I didn't have I did not have a cell phone in high school. Like that's fucking crazy.
Yeah. Absolutely.
I didn't have a cell phone in high school until I graduated high school. I had a flip phone. Like they lose their minds and they're like, how'd you call people? I'm like, I
Seriously.
didn't.
Yeah. They're like, where's Snapchat?
Yeah,
No,
exactly.
there's no Snapchat.
So it's just funny because their generation, like their kids are gonna grow up with AI and they have to, I tell them, you need to think about a job that AI cannot replace
take
you.
over.
And that's crazy that I have to tell my kids that. Our job, thank God, AI is never going to replace. It can replace some things, but it's never going to fully replace
no
our
one
job.
gets my hair like OC hair
queen. So like, you know what I'm saying? And that's kind of crazy to tell your kids that though. You're going to have to tell your kids that too. That's wild. They're going to grow up with way more than an iPad, way more than, you know what I'm saying? That's wild. Yeah.
They're going to have little robot friends.
Yeah, exactly.
They won't even have to make friends anymore.
Yeah. Exactly. That's what I'm saying. Like there's the COVID babies. There's this whole generation. That's a whole generation too, the COVID babies. You know what I'm saying? So that's a big thing that I don't even think about. That my kids, during COVID, I kept telling them, you are living through U.S. history. Your children will read about COVID in a book. And that to me was mind blowing.
It's crazy.
Right?
They're going to be like, you survived COVID?
Yes. Like, and that's like the Great Depression. And that's like the things where I'm like, that's so stupid. Like, you know, and I'm not a big history buff. So I was stupid. Like, so for my brain to think about that, I was like, that's really wild.
Yeah. You know, when you read about the plague and you're like, oh my God, the plague.
Yes.
I feel like the next generation.
I've said this. I said, this is real life Bible shit. Like, I was like, what's going to happen to now? Fucking the leopards are going to be cut.
Yes.
Or I forgot what they call it. Those bugs.
I know what you're talking. The ones that were biblical bugs.
Yes.
Not wasps.
No,
they're like wasps.
yes.
Or grasshoppers.
Yes,
the grasshoppers.
Yes, but they're called something.
Yes, I can't remember the name. Locust. Yes.
That the locust is going to come. See, you don't think I know Bible stuff.
Yes,
Get
the
out of
locust.
here. I know the locust and all that shit. Yeah. The third coming or whatever the hell. Yeah.
She's on it.
I know. See? Thank you. Well, Nour, thank you so much for coming.
Thank you guys.
You were seriously so refreshing.
Helpful. Thank you guys. I had such a good time. I was really nervous, but I had a blast.
Good. I'm glad we made you feel so comfortable.
No, you guys are great. This is your natural habitat. I mean it.
You.
You guys slayed. I was so nervous, and now I feel like I'm at home. Like we can do this for another hour.
Yes. We're gonna have you back after when you get your gyno and you're working, and then this is gonna be on a next level too.
Thank you guys.
Thank you,
It was such a blast.
So much for coming.
Thank you guys.
Thank you.
Thanks.